I'm Catherine Zuckerman. I'm Associate Professor of General Pediatrics at Oregon Health and Science University, Dornbecker Children's Hospital in Portland, Oregon. I'm the lead author of this study, Parent-Reported Severity and Health in Educational Service Use Among U.S. Children with Autism. We did this study because we know from our research and from research of others that access to care for autism spectrum disorder is complicated. And in order to get the full range of services that most experts would recommend for autism, families are going to need to access services both in the educational setting, i.e. at school, and then also in the non-school-based setting, like in the medical setting or through their health insurance. And we know that unmet need for care in autism spectrum disorder is typically pretty high, with a majority of parents reporting high rates of unmet need for care for autism spectrum disorder. We really, in this study, wanted to look at the relationship between parent-reported severity and service use, because one would think that if kids have more severe symptoms for their autism, that they would need and use more services. But when we looked in the medical literature to see what there was on this topic, there was really very little. And so our research question was really, how does parent-reported severity impact service use across settings for children with autism spectrum disorder? And we used data from the 2011 Survey of Pathways to Diagnosis and Services, which is a nationally representative survey of children with autism spectrum disorder. It's a parent survey, so parents were reporting results on their children. And the survey asked parents questions about many different kinds of therapy services that children would use, including behavioral interventions for autism spectrum disorder, which has the strongest evidence base, then a variety of other services such as speech and language therapy and occupational therapy and other therapy types that children with autism would need. And for many of these, it allowed you to say if this therapy was delivered at school or in the non-school-based setting. It also asked about medical specialty provider visits, and so we were able to see if children with autism were seeing specialists like developmental pediatricians or psychiatrists or neurologists or psychologists who might be able to help manage autism symptoms. And then the survey also asked about parents to report on their child's level of autism severity. What we found when we looked at the results of this survey was that, unsurprisingly, higher severity was associated with more service use across settings, so both in the school-based setting and in the non-school-based setting, and also was associated with higher levels of specialty provider visits. However, there was still pretty significant variability in service use, and this was true across the range of severity. And in particular, it was interesting the services that children were not using. And so about 17% of children overall who had autism in the survey weren't using any of the therapies asked about in the survey. And about 30% of the children in this survey also weren't seeing any medical specialists on a regular basis. And if you looked at the mild end of the severity spectrum, the rates of non-use of therapy were even higher. So about 25% of children with mild autism were using none of the interventions asked about in the survey, for instance. But even when you looked at the more severe end of the spectrum, there was still pretty significant rates of children who were not using a lot of therapy. So about 50% of the children who had severe autism spectrum disorder were using school-based services only. Also, about 50% of kids who had severe autism spectrum disorder weren't using any behavioral interventions, which have the highest evidence base for autism spectrum disorder. And about 1 in 10 children with severe autism spectrum disorder weren't seeing any medical specialists for their autism. I think the study results suggest that many children with autism spectrum disorder probably aren't getting all of the therapy services that they could use. And this was true across the severity spectrum, both for kids with mild autism spectrum disorder and for kids with more severe symptoms. I think in terms of policy implications, it really suggests to providers that we need to make changes to our system to make these services more easy to access for families. From a clinical perspective, I think healthcare providers really need to think about service access when they're talking to families of kids with autism spectrum disorder, and not assume that families know what services their kids can use, and also not assume that they know how to access these services, because many children are not accessing what most experts would consider the full complement of services. And I think from a research perspective also, we as researchers really need to work harder to find evidence-based ways to help kids with autism spectrum disorder access all the services that they need.